Well, hi everyone again. As Angela stated, we're going to just do like an information session, an overview of the kinship benefit programs that we speak about a lot with our families at OhioKAN. This may be a review for some of you. You may already be accessing some of these programs, or some of this information may be new to you. And so just some housekeeping, as Angela stated, feel free to type your questions in the chat, and we'll have two kind of spaces during this presentation for questions, and one in the middle and then one at the end, and we'll do our best to answer those for you. So I'll go ahead and pass it over to Paula.
All right, thank you. Good morning and welcome to Let's Talk About Benefits, an information session for kinship families. My name is Paula Oliver. I'm one of the statewide benefits coordinators here at OhioKAN. I've been with OhioKAN since October, and I'll pass it on to Amber.
Yes. So again, my name is Amber Robinson. I'm the other statewide benefits coordinator with OhioKAN. I've been with OhioKAN, I want to say 2 years and a couple months. And Paul and I, we provide benefit coordination to support OhioKAN families, as well as our navigators who work one-on-one with families. We do that by providing internal trainings just to keep folks up to date on all things benefits, as well as external trainings like the ones we're doing today for kinship caregivers and adoptive families. And then we also do some data tracking on barriers to access when it comes to some of these programs. I have a background in mental health and working in social services kind of fields, but we're really excited to present to you all today. So we mentioned today we're just going to be covering some benefit programs that kinship families can access, and then just some other public benefit programs that aren't necessarily just for kinship families, but that are available to kinship families, and then we'll wrap up with answering some questions. And so the first program that I wanted to kind of do an overview and discuss today is the Kinship Support Program, or KSP. Feel free to type in the chat if you've heard of it before, or you can feel free to raise your hand. But the Kinship Support Program was designed to support kinship caregivers by providing financial assistance for the placement of children in your home. So we've heard it referred to as kin cash, or some families say, I'm getting a kinship payment, or some type of financial assistance for caring for example, my grandchild or my niece and nephew. So this is one of the financial assistance programs for kinship caregivers. And so as far as eligibility, this program looks at the kinship caregiver. So that, of course, is anyone who's 18 or older who was caring for a child in the place of that child's biological parents. So examples we have here could be grandparents, siblings, aunts, uncles, cousins, step-parents, and step-siblings. Or it could be someone that's not biologically related to the child. They could be any non-relative adult who has a familiar and long-standing relationship or bond with that child. And so if you meet that kind of requirement for the family kind of piece, or that kinship caregiver identification, you could be eligible for this program. Now, the other piece of that, though, is that Children's Services, so the Public Children's Service Agency, would have to have some type of custody of that child while they are being placed in your home and you're caring for them. So that's the other piece of eligibility. So sometimes it could be, for example, Children's Services, maybe they have an open active case, they're involved, but they also have custody of a child, and they call you and say, hey, can we place your grandchild in your home? You say, yeah, sure. So what that worker does is they complete and approve a kinship home assessment. And they have to put some information on the back end in a system called SACWIS. And once they do that, it will identify you as an approved kinship home, and then you will then receive that financial payment through the kinship support program. My apologies. And so once that happens, you will get that payment. There is no application that is needed for this program. This is, I want to say, the only program where you don't have to apply. So there's no paper to sign off on or anything like that. It's kind of like an automatic process that happens on the back end once you are identified as an approved kinship family. When that child is in the custody of children's services, though. So it wouldn't be if you had temporary custody, you had legal custody or guardianship of the child. This is only when children's services has custody and the child is just being placed and cared for in your home. And then as far as the amount or the incentive and how long you would receive it, so there is for a lot of these programs set rates. This recently increased from, I want to say it was like $10.80 per day to now it is $11.74 per day per child. So you would get that payment in a monthly incentive for each child for up to 6 months. So that's the maximum amount of time that you could receive this payment. It could be less. And if it is less, it would either be if you decided to become a foster caregiver and you obtain your foster care certification, just knowing that if you chose to do that and you were receiving KSP, that the Children's Service Agency can waive a lot of those requirements that one would typically have to complete in order to kind of fast track you to obtaining that foster care certification. So if you decided to do that, you would no longer receive the KSP or the kinship support payment, and then you would just be getting that foster care per diem that is set. Another kind of avenue, if you were to get that less than 6 months, if of course the child is no longer being cared for by you and they're no longer living in that home, or if funds run out for that program. And then just wanted to note here, because I know we've had questions from families about what happens when I do reach that maximum, that 6 months period of getting payments. How can I continue to get some type of financial support? So there is an option, and we'll talk about this later on, but I'm sure most of you maybe have heard of Ohio Works First or the Cash Assistance Program. So there is a child-only version that we'll talk about where families could apply for this to kind of continue getting some type of monthly payment. It wouldn't be through KSP. It would then be through the Ohio Works First. But about that last month or so that you're going to be getting that last payment, ODJFS, the Ohio Department of Job and Family Services, sends out a letter letting you know you're coming up on like that last payment. And you could use that letter as like documentation when applying for the child-only payment so that there's not a lapse in receiving some type of financial support, because it could take sometimes up to 30 days for Job and Family Services to make that determination. So if you're like a month out, you could use that letter, go ahead and apply for that program. And then if approved, you would then switch to getting the Ohio Works First child only.
Just a quick clarification from the chat.
Yeah.
So you can't get any of this unless Children's Services is currently involved, correct?
And yes, but it's more than involved, because sometimes you could have where, you're caring for a child and Children's Services has an open case, but they don't necessarily have custody of the child. So this is when they have some type of custody of the child and they're placing the child in your home and you're identified as a kinship placement. That makes sense.
Yeah.
That would have to apply in order to be eligible for KSP. Are there any other questions?
I think that's all for now. Thank you.
No? Okay. All righty.
Eye on it.
Thank you. All right. So I'm going to pass it over to Paula.
All right. So now we're going to talk about the Kinship Caregiver Program, also known as KCP. KCP provides family stabilization and caregiving services for kinship caregivers. So there's two portions to KCP. The stabilization funding can help pay for incidental costs incurred when beginning to care for a child unexpectedly. And then the caregiving funding can be provided as reimbursement for child caring services. So KCP provides that financial support to kinship caregivers for stabilization and caregiving services. The stabilization services are designed to transition your child into and maintain them in your home. And this allows for most eligible caregivers to receive stabilization funds. Examples of those funds are not only limited to child care services, but also things like basic needs such as beds, clothing, just essential needs. And then the child care services are not to exceed 4 months. So the benefits of the services are limited to reimbursement to you for or direct payment to a third party, individual, or entity to administer to the needs of your minor child. The caregiving service may be provided at a licensed or unlicensed provider or may take place in your home. The care may include care designed to provide temporary relief or child caring functions. So eligibility varies from county to county when it comes to KCP. Some counties, legal guardianship is required, and others, they're just the eligibility requirements may look different from one county to the other. So a kinship caregiver is anyone who is 18 years of age or older, related by blood or adoption, and is caring for a child in place of the child's parents, grandparents, siblings, aunts, uncles, nephews, and nieces, first cousins once removed, step-parents, siblings, step-siblings, spouses and former spouses of individuals related by blood or adoption, or step-parents and step-siblings, and a legal guardian or custodian of that child. So eligibility requirements include for stabilization services, the child's gross income must be less than 200% of the federal poverty guideline. For caregiving services, the household's gross income must be less than 200% of the federal poverty level. For caregiving services, the caregiver must participate in one of the following. They must either be paid full-time or part-time employment in a training or education activity, or one or more work activities as a condition of eligibility for the Ohio Works First and Supplemental Nutrition Assistant Program, also known as SNAP. When and how to access KCP: when the child is placed in the eligible kinship caregiver's home, or when a court grants legal custody or guardianship to the caregiver. Families must apply through their county agency. In some counties, the JFS agency accepts applications. In others, the PCSA accepts applications. So KCP programs vary by county and are detailed in each county's prevention, retention, and contingency plan, also known as PRC. So the amount of incentive and payments and duration varies by county. Stabilization services can be used for up to 4 months. The allowed duration of caregiving services varies by county.
Any questions over KCP?
Just to clarify again, so for KCP, the children's services piece isn't as important, or it doesn't matter, depending on the county.
Yeah, so with KCP, so with this program, it is, and we'll talk about this as we move along, it is embedded within every county's PRC plan, which stands for Prevention, Retention, and Contingency Plan. And so those plans, every county has it, all 88 counties, and those plans contain a list of services and supports that can meet various needs for families that are kind of needing some type of financial support or assistance. And so the Kinship Caregiver Program is embedded within that plan. And so it's governed on the county level. That's just kind of how it was written. And because of it being governed on the county level, it gives the counties a little bit more freedom on how they set up certain pieces of eligibility. So there are some standard pieces that are not going to change. So that 200% that Paula talked about for the federal poverty guideline, that's the standard limit that they're going to look at when they're looking at the financial eligibility. So for the stabilization piece that Paula mentioned, they are going to look at the income of the children only. So similar to OWF child only that we'll talk about, they're only wanting to look at what that income is for the kids, but it's still 200% as far as the limit. And then the caregiving portion of this program, it is looking at the household income. And then the caregiver has to be working in school or job training. So that usually across the board, it's the same. Now, where it differs, though, is you'll see some county PRC plans for KCP that says, you know, you have to have legal custody or guardianship to receive services. But then you'll look at the next county over, that's not a requirement. It opens it up to any kinship family, regardless of the custody situation. You'll have some, the next county will say, you have to have an active and open case with children's services in order to access KCP. So those pieces vary, and it just depends on the county. I will say, just so you all are aware, we have been tracking KCP very closely, because while this program we know can be very helpful, right, to help pay for, offset the cost for purchasing those items you need for your kids, so clothes, shoes, bed, furniture, anything you can think of. And I will add too that some kinship caregiver programs based on the county even can help pay for like rent and utilities, but some don't. So it really varies county by county. But what I was going to say is that we're tracking this. We've been tracking this program very closely, because while we know this can help with those kind of hard good items, and as well helping to pay for the cost of childcare, which we know is really expensive, right? And there are limited resources out there even for that. Families are just having a really hard time accessing this. So we do a lot of data tracking on our end as well when we're talking with families, to kind of make note of what barriers folks are running into in accessing programs. And so we know that, out of the basic needs that we track, financial assistance, childcare being some of the top needs, and identifying programs like this as being one that can help, families are still just having a hard time accessing it. And from what we're finding is because of the differences in how you can access this. So you may have a county that's like, yeah, any kinship family, right, can access it. But then the next one, it says only those families that are open and active with children's services. And then even if it says that, we're still having to do a lot of runaround and digging and investigating to find out how do folks even go about applying for this in that county, because some counties you have to go through job and family services, some say go through children's services, and there are different steps and procedures and even getting approved. So it's a program that is really helpful. The amounts that they can provide per year vary. So some counties may say $1,500 per child. Another county may say $1,000. But just so you all know, though, we have been working closely. So we work closely with Veronica Burrows, who is the Ohio Department of Job and Family Services project manager for OhioKAN. And so we have been keeping a watch on KCP, because it's not in the budget for the next fiscal year. And that's a concern we have, because we know this can be really helpful for families. So we're just kind of keep an eye to see if they're going to put that back in the budget, because if not, that means that by the end of this fiscal year, which will be June 30th, then KCP will not continue, unfortunately. So we will continue to kind of keep an eye on it and see what happens. We've been trying to advocate, and we've been sending information to our project manager about this, with the hopes that other advocates around the state as well can kind of push to keep this program going for families.
We did have one more question or comment. If someone needs help with this application and they're interested in trying to apply, is there any recommendations for that, getting help with it?
Yeah, so I mean, in general, depending on the county you're in, some counties have a specific KCP application. So it's very specific for that program. Other counties, they'll say, well, you have to fill out our general PRC application. So at first, I would say that the first step is figuring out in your county, is there a specialized application for this program? Or do we need to complete just y'all's general PRC application? And then from there, who does this get submitted to? Does it get submitted to Job and Family Services, or does it get submitted to Children's Services? We at OhioKAN, because we know that this program varies county by county, me and Paula, we do a lot of digging on trying to contact folks, in these counties to say, hey, send us the application that you have, and we're just slowly collecting it as we get families calling in and needing that support through this program. So even if you are connected, or if you did connect with us at OhioKAN, depending on where you live in the state, we may be able to assist you further with that as well.
Thank you.
Answers the question. Yeah, you're welcome. All righty. So I'm going to pass it back over to you, Paula.
All right, we're going to talk about the Kinship Permanency Incentive Program, also known as KPIP. KPIP provides a limited number of incentive payments to families caring for kin. Eligibility is a kinship caregivers as defined in ORC 5101 with legal custody or guardianship. The following individuals related by blood or adoption to the child: grandparents, siblings, aunts, uncles, nephews, nieces, first cousins once removed, and so on. But I'd like to note here, unlike the other programs, you have to be a legal guardian or custodian. You can be a blood relative or a non-relative, just as long as you have legal guardianship or custodianship. Caregivers' family income must not exceed 300% of the federal poverty guideline. The County Public Children's Service Agency must have an approved kinship home assessment and completed background check. So family income for the purpose of this program includes parents and children, but would not include grandparents. For example, maybe a grandparent or grandparents living in the home, in the basement. That income, if the grandparents are receiving an income, would not be included in the total income for the family, just the parents and the children.
Yeah, so what you mean, Paula, basically, for family income, for the purpose of this program, they're not going to look at household income. They're only going to look at the income of the kinship caregiver, their spouse, if that applies, and then the children that they are caring for. So sometimes I know we worked with a family where that, it was a family, it was a caregiver, their spouse, and the kinship child, but they were living in the same home as the grandparents. And so they were wondering, like, hey, do we report income for everyone, including the grandparents, or is it just us? And so for the purpose of this program, just use the kinship caregiver, your spouse, and then the kids. And then too, I want to note here, the background check piece, we had questions about this before. So Children's Services is going to give you all of that information. They're going to connect you with a worker that will complete that and complete and approve that kinship home assessment. And then they'll also connect you to whoever their folks are to complete the background check. But I do want to note here that some counties cover the price or the cost of that background check, whereas other counties, they say you have to pay for that out of pocket on your own.
So you can access KPIP after a court order grants legal custody or guardianship to the kinship caregiver. A temporary order is not sufficient. The kinship caregiver must submit an application for kinship permanency incentive, verification of custody or guardianship, and verification of income. The PCSA must complete and approve a kinship home assessment.
And then just to note here, as far as the application, you could get that from your local children's service agency. So whatever children's service agency in the county that you reside, that's where you can get those applications. And we did note the application kind of identifier here, that JFS 01501. So if you wanted to print that off on your own, it is accessible online on the Ohio Department of Job and Family Services website. And you can print that out, fill it out, and then submit it to Children's Services with that verification noted here.
Okay. Eligible kinship caregivers will receive an initial payment. Currently is $525 to help defray the cost of the initial placement. You may receive subsequent payments, currently $300 at 6-month intervals to support the stability of the child's placement in the home. The incentive may not exceed 8 payments. The incentive amount is subject to change. At the beginning of each state fiscal year, ODJFS publishes a procedure letter for PCSAs identifying those amounts.
Any questions for KPIP? And again, here it says that you can't exceed 8 payments, but again, because you can only apply for this at minimum every 6 months, if you think about it, if you apply for it twice a year, you can get this over the course of like 4 years, with that initial payment being the highest and then the subsequent payments being that $300 per child.
So you can reapply for it.
You can, so yeah, you would have to. So for example, say I applied for this program and, I got approved. I got my 525 for one child. 6 months later, I would reapply by filling out that application again for redetermination, submitting that to Children's Services again with likely proof of income because they want to make sure you're still within that 300% federal poverty guideline and that you're not over. And then once approved, you would then get that next payment. So it's not like you apply once and you continue it every time you need it. You would have to apply. And I've worked with families, they don't necessarily do it every 6 months. They may do it every year, once a year. It's just when you need it, you could use that extra income, but you would need to apply every time you want the next payment.
Thank you. And I don't see any questions in the chat, so.
Okay, thank you. Alrighty, so we're going to move on along. So those were the kinship programs that we wanted to review with you. Those are just the ones that we talked to with families quite a bit. And so next I wanted to move on to some programs that you could access as kinship families, but any family pretty much could access through the Ohio Department of Job and Family Services benefits portal. And so those programs that you can apply for through the portal are for cash assistance, so the Supplemental Nutrition Assistance Program or SNAP, food assistant, or I'm sorry, not cash. I said that the whole backwards. Cash assistance is the Ohio Works First. Food assistance is the Supplemental Nutrition Assistance Program, medical being Medicaid, and then child care assistance. So just a quick overview, the Ohio Benefits Portal is just one way you can apply for these programs, and it's an electronic self-service portal that helps process applications in near real time. So you can go on this portal using this website, you can create an account, apply for the programs you need to apply for, submit all your documentation, and then once you submit that, it gets sent to your local job and family services. Well, they'll review it, and then they will reach out to you for next steps. You could also keep up to date on the status of your application, read any messages through that portal. And so the first program that I want to review is, again, the Ohio Works First program, or the cash assistance program specifically. And so just an overview, starting with TANF. So I'm sure probably people have heard of that. That stands for the Temporary Assistance for Needy Families program. This is a larger program that provides grant funds to provide families with financial assistance and other related support services. So as I mentioned, PRC that I briefly mentioned, that PRC meets some standards of TANF, and I'll talk about that once we get to PRC. But just so you have an idea, that TANF basically funds and provides financial assistance and services that kind of support families at large, and then one of those being those cash assistance programs. And so Ohio Works First provides monthly time-limited assistance to families with or expecting children by providing parents, caregivers, or specified relatives with financial assistance and support. And then the child-only version of this program is the same thing, providing that financial assistance on a monthly basis, but this one is limited until the child is either 18 years old or 19 if they're still in school or no longer living in the household. So Ohio Works First, the one on the left, we'll think of it as like a time limited, and that's usually up to 36 months where you could receive this financial benefit. And then child only is a little bit longer, depending on how old the child is, where you could get that until they're 18 or 19 if they're still in school. And you get it up to that point or sooner if they're no longer living in the household.
We did have, oh, sorry.
Go ahead.
Finish. Someone just asked, is there a way to get back pay from not getting the child only check?
I don't think Ohio Works First does like a retro pay for child only. It would just be at the time that you apply. So at the time you apply and you get approved, that's when those payments would start. They wouldn't say, oh, the child has been in your home X amount of months, then we're going to back pay it, if that makes sense, for Ohio Works First. Now, I want to say for KSP, KSP, the kinship support, that one, from my understanding, they backdated to the date that that kinship home assessment was approved, if that makes sense. But the Ohio Works First, it's just the date that applied and got approved for that program. And for this program, they can take up to 30 days to make a decision, but anything prior to that, it wouldn't be retroactive.
Thank you.
Yeah, you're welcome. And then again, just kind of reiterating what I mentioned, Ohio Works First being that financial assistance portion of the state's TANF program, providing that time limited and child only cash benefits to families who are eligible. And so first I want to talk about the child only, because we do talk with families a lot, especially kinship families who are eligible for this program or version of this program, the child only. And so when they're looking at the eligibility as far as relation, they're looking at whether the child or whether you are a specified relative to that child. And so as they define a specified relative, it could be someone related to the child by blood or adoption. And when I say related by adoption, it doesn't mean that you adopted that child. It means you're related to the child by adoption. So maybe the child's parent adopted them and you're like the adopted grandmother, right? But you're caring for them in a kinship type of situation. Then you would be eligible when I mentioned that adoption piece. Or it could be related, not related, but you could have legal custody or guardianship of the child as well. So again, we have those same examples of how you could be related by blood or adoption to the child listed here, but they're really wanting to determine, are you a specified relative of that child, and are you caring for that child in place of their biological or adopted parents? Whereas time limited, so again, that 36-month version of it, it could be any family. It could be a biological parent related to the child. As long as they meet income eligibility requirements, they're eligible. It could also be individuals who are at least 6 months pregnant. They could be eligible for this program even if they don't have any other minor children in the home. So a pregnant individual could get OWF time limited. And then the other kind of piece to the time limited version is that the individual must be either working in school or some type of job training program. I do want to note here, because I know folks like to know what the income threshold is for Ohio Works First across the board, whether it's child only or whether it's time limited. It's set pretty low at 50% of the federal poverty guideline, but that's the standard income eligibility that they're going to look at. And so here I just have more so just a comparison chart to see the differences. So again, for both programs, if you're applying, you have to, be living in Ohio. The Ohio Works First time limited. This is anyone, parent responsible for a child under 19 if they're in school, or 18 if they're not. And then meeting that income requirement. So again, that 50% of the federal poverty guideline, they're going to want to know what that income is for the whole household. So the parents, including the children. Individuals either unemployed or underemployed, either way, just meeting that income threshold. This could apply to individuals at least 6 months pregnant. Most adults and heads of household need to be participating in that work, school, or job training requirement and sign a contract stating that they will continue participating in one of those activities in order to continue receiving the time limited Ohio Works First payment. Now, for the child only version, eligibility is only consisting of the minor kinship children in the home. So they're not going to want to know the income of the household or you as the kinship caregiver. They're just wanting to know how much is the children getting. So sometimes kids could be getting like SSI. We'll talk about that, supplemental security income. Or maybe they're getting like a survivor benefit if one of their biological parents passed away. That would be counted as the children's income. And so they would look at that income and say, for an assistance group of one child, for example, how much income are they getting? Sometimes, most of the time, kids are, we see kids getting no income, so they would be eligible. But if they're getting any income, they would count that and compare that to 50% of federal poverty guideline for one child to determine if they're going to be getting that Ohio Works First Child only payment or not. And then also for here, that caregiver does not need to be working in school or job training in order for that child to receive this child only payment. And I'm going to go ahead and move on along here. So just briefly, the amount of assistance, it depends, right? So it depends on how many kids you got. If you got one child, it's going to be a standard amount of, I want to say, don't quote me, but it's like $440 something maybe for this year for one child. And then the amounts increase the more kids you have, the more kinship kids you have in the home. So just knowing, and we can even, I'll send this in a follow-up because every year ODJFS sends out that procedure letter that has the updated amounts. So there's a new chart for 2023 and we can send you that out. But just know that those amounts increase with the increasing number of kinship children you have. And again, you can get that monthly payment until the child is either no longer in the home, they either turn 18 or 19 if in school, or there's a change in circumstance. So that could be maybe you were initially caring for one child, but then maybe you're now taking care of two other grandchildren. So you want to update Job and Family Services of that because then you could get more in that monthly payment. Or say maybe you were initially caring for three, and then now maybe one of them turned 18 or something. So now it's two. So then that amount would go less. So those are just some of the situations where that amount would either change or you would no longer receive that. And then if approved, you do get those benefits through what's called an Ohio EPI card. It's basically just like a debit card. You could use that for paying bills, getting the kids the things they need, whatever it is. You're not restricted on, how you use that card. And then that amount gets uploaded onto that card monthly. And then when and how to access it, again, as long as you are identified as a specified relative or having legal custody or guardianship of that child, you can apply for this program. Again, for the time limited version, as long as there is a financial need for that family, even if it's a biological parent needing some financial assistance, they can apply for this. And then again, applying for that through Job and Family Services, whether that's online through the portal or contacting Job and Family Services, getting an application that way.
Okay, now we're going to talk about Supplemental Nutrition Assistance Program, also known as SNAP. So the Ohio Supplemental Nutrition Assistance Program, SNAP, provides nutrition benefits to supplement the food budget of families so they can purchase healthy food. It's important to note that anyone a family lives and buys or makes food with counts as a member of that household, with some exclusions, like tenants who are renting a room or adult children 22 years old and older, who buy or make their own food. A caregiver cannot apply for SNAP for just the children only. So households that meet income, expenses, and resource eligibility requirements are eligible. And also a household may consist of an individual or a group of individuals who live together and usually prepare their food together. Household expenses could include rent or mortgage, gas, electric, water, sewer, phone, and medical expenses, as well as any child support or child care payments. Household resources could include cash savings and stocks. It's important to note that in Ohio, here is no SNAP child only, like as stated in the last slide. It's solely based on household members who live and prepare their food together in their combined gross monthly income.
And I'll add here, because we've had families think of like kind of how we just talked about child only cash assistance. Folks are like, hey, is there a child only, way from just the kid in their home to get SNAP? And there's no way to do that. They're just going to look at the household income. So how many folks are in the household? What is that household income? I mean, this is different a little bit because there was the, what was it called? The pandemic EBT, PEBT, that was occurring during the height of the pandemic, which was that added kind of amount that kids were getting, but that is no longer. And so it's just in general, they're going to look at the household income and for those who live, prepare, and eat food together.
So to get SNAP benefits, families must apply in the state in which they currently live and must meet certain requirements, including resource and income limits. Specifically, families would have to be at or under 130% of the federal poverty guidelines. SNAP income and resource limits are updated annually, and the exact eligibility guideline amounts differ based on income, resources, and family size. So a few SNAP tips. The amount of assistance varies depending on the household. The electronic benefits transfer card, also known as EBT, can be used like a debit card to purchase eligible food in authorized retail food stores. Families will receive a letter from their local CDJFS with instructions on when and how to recertify benefits, and families can recertify through the self-service benefits portal.
Any questions?
Tony had a question specific to SNAP, and then we had two other
Oh,
questions.
yeah, sure.
Tony said my grandgirl got a food benefit added to her EPPI card, and I couldn't access it because I didn't know the password and I was unable to find it. Do you have recommendations if that's a situation you're in?
Yeah, if you're having issues accessing like the card information, there is, I can send this to, because there's like a contact for the Ohio Epi card, so that if you're having issues like resetting the password or forgetting the password or those kind of things, they can troubleshoot that for you. So I can make sure in a follow-up email, Angela, I'll send you that as well as those of Ohio Work First payment amounts.
Thank you. We have two other questions, but I can send
sure.
the other ones. Okay. This was related to the OWF. If you get the monthly payment, can you still get health insurance?
Yes. So, I mean, we'll talk about that next. So for all of these programs, right, there are income eligibility requirements. So as long as you're not going over whatever that federal poverty guideline is for Medicaid, for example, you are eligible to, maintain those other programs. It's all about your income. So we do see a lot of families that are getting Ohio Works First Child only, SNAP, and Medicaid, or maybe just a couple of them based on their need. But each of these programs have different federal poverty guideline limits. So it's not like if you receive one, it's going to automatically cancel out your eligibility for another. It just depends on how much your income is looking like. Now, and we'll move on to the Medicaid piece for as far as like the health insurance that we typically support families with. And just so you know, with Medicaid, they have a couple or handful of federal poverty guideline limits based on, I guess, the assistance group. So there is a certain limit for individuals, a certain limit for families, a certain limit for pregnant individuals. And then there are 2 limits for children with insurance and then without insurance, because Medicaid sometimes can be used as a supplemental insurance if a child is already on like a primary private insurance, for example. Okay, and then just breezing through here, just as we mentioned, for Ohio Works First, as it is with SNAP, you can apply through the many ways we've discussed through the portal, through the application. And we do have this application titled here if you wanted to look it up and print it out and fill it out, and then submit it by hand to your local job and family services. So next, just as we kind of started talking about, is Medicaid. And so Medicaid is a state and federally funded healthcare coverage plan that provides medical insurance to low-income and medically vulnerable individuals. Medicaid covers a wide array of services, so it can include funding for doctor's visits, dental and vision services, medication, emergency services, mental health services, transportation to medical care, and much more. Medicaid includes what are called, oh my goodness, managed care plans or managed care organizations, or MCOs. And so you've maybe heard of things like CareSource, right? Or you've heard of like United Healthcare, I think they have another one called Aetna. So those are just some examples of managed care plans. And so those managed care plans provide a whole bunch of services and supports that can meet families' needs. And so what it looks like is when you apply for Medicaid and you get approved, they'll send you a letter from ODJFS asking you to select a managed care organization. So you have that option to do so. But if you do not select one, they'll select one for you. We've had families that, have either selected a managed care plan or
The minute I walk out here, my service does.
I'm sorry?
We have Jobs and Family Services in a Zoom meeting.
So yeah, so when you apply for this program, whether you select a managed care plan or you don't, and Job and Family Services selects one for you, you have, I believe, a period of 90 days to change it if you're not happy with it. So maybe, for example, you have CareSource, but you find that all the providers in your area don't accept CareSource, right? And they accept, United Healthcare, for example. Then you have that opportunity within that window to change it. But if you don't, you do have to wait until the next open enrollment every year in order to change that plan. And so as far as eligibility, like I mentioned previously, we have a whole bunch of different assistance groups that Medicaid looks at. So it could be an individual, family, infant and children, pregnant individuals, and disabled individuals. And each of these categories have different federal poverty guidelines as far as the income piece is concerned. And so some more on eligibility, of course, if you're applying in Ohio, be a resident, you have to show proof that you have or you're getting a social security number, be a US citizen, or meet Medicaid citizenship requirements. And then this link here in the PDF slides, it should be clickable. And this will show you for 2023, the federal poverty guideline amounts for those different groups that I mentioned here. So if you look at the chart, it'll show like for a household of 2. And then if you're trying to apply for a child that doesn't have insurance already, and it'll say what that federal poverty guideline is and how much that income has to be, or what that cap amount is, right? So it can't go over that, and they're going to look at the income for the household. And then as far as the qualifying time period, eligibility is now again being reviewed every 12 months. And I wanted to kind of put a blurb in here. I don't know if you've all have heard of this already. Maybe if you or maybe the children you're caring for are on Medicaid, there was this unwinding process that occurred. So during the height of the pandemic, folks did not have to renew or do the redetermination part for Medicaid, but they have recently started that back up again. So people were getting letters in the mail telling them to update their contact information, their address, their phone number, and then they may have to even submit income verification again so that they can determine whether those who have Medicaid will continue Medicaid based on the eligibility requirements again. So if you haven't already, we just want to remind folks for all of these programs, make sure you keep Job and Family Services or Children's Services updated with your contact info when sending out any important information. Do we have any questions on that? All right, and then quickly here, so how to access Medicaid and when to apply. Apply whenever there's a need. If someone doesn't have medical insurance and there is that financial need for that type of insurance, go ahead and apply through your Job and Family Services or through the portal. And then we also have here the Medicaid Consumer Hotline. They can answer general questions about Medicaid, but if it's anything specific, they may just kind of direct you back to your local Job and Family Services, but this is also a number that you can contact as well.
Okay, now we're going to talk about publicly funded childcare. PFCC is publicly funded childcare is a financial assistance program that helps pay for the childcare of infants, toddlers, preschool children, and school-aged children under the age of 13 by an eligible provider. So when it comes to PFCC's definition of a family and child, a family is one or more eligible caregivers and all minor children who reside with the caregiver in the same household. A caregiver, a minor parent, and the child of the minor parent when all reside in the same household. A caregiver with shared custody of minor children and all children who reside with the caregiver in the same household. Minor children with more than one residence due to shared custody agreements are counted in the caregiver's household during the time periods they reside with that caregiver. a caregiver who is a foster parent and or step parent and all the minor children who reside with the caregiver in the same household, married caregivers and all minor children who reside with the caregivers in the same household, and unmarried caregivers who live in the same household with a common child and all of the minor children who reside with them. Both are considered caregivers for all the children in the family. A child is eligible for this benefit if they're 13 years old or younger, and 18 years old if the child has a special need. So to become eligible for publicly funded childcare, there are income eligibility limits. For initial eligibility, a family's gross monthly household income must be at or below 142% of the federal poverty guideline. After that, it increases to 300% to maintain ongoing eligibility. Families can be eligible for all or part of their monthly child care expenses. And again, gross monthly household income means total income before taxes. This could include a family's paycheck, child support, cash assistance, Social Security, disability, etc. Finally, the need is established by caregivers' participation in work, school, or training. And then the qualifying time period, the county agency reviews cases every 12 months to decide whether income or other changes affect eligibility. So when and how to access a PFCC? When searching for childcare in Ohio, families can visit childcaresearch.ohio.gov. This website allows families to search for childcare by county, city, zip code, program type, and view the provider's step up to quality rating. Families can apply using the benefits portal in person, by mail, or by visiting their local CDJFS and completing the application. And for questions about PFCC, families can call their local CDJFS. And we've provided the number on the slide.
Okay, any questions about childcare, publicly funded childcare? All right, so the next program is WIC, or Women, Infants, and Children program. And so this is a special supplemental nutrition program for women, infants, and children. I know it says women, but it doesn't necessarily have to be an individual that identifies as a woman. It could be someone that identifies as other, and it provides nutrition education, breastfeeding education and support, supplemental highly nutritious foods such as cereal, eggs, milk, whole grains, fruits, and vegetables through what they call a WIC food package, and other supports and services for parents and children. And so as far as eligibility, it could be anyone who is meeting those income guidelines that are pregnant, breastfeeding. It could be someone that just had a baby, or it could be someone caring for an infant from birth to 12 months or a child up to age of 5 years old. And so as far as eligibility, you would have to be present at the WIC clinic and complete an appointment and provide proof of identity, so proof of legal custody or guardianship, and proof of income. So as you see here, that income for the family can't be over 185% of the federal poverty guideline. Of course, you need to be a resident of Ohio, and if applicable, determined by a health professional to be at medical or nutritional risk. So show proof of that or proof of pregnancy. So those are just some of the requirements for WIC. And then as far as the qualifying time period, it is meant to be short term. And so once you receive benefits for a certain period of time, you typically graduate from the program. And then the length of time you are enrolled in this program depends on your situation. So for example, if you're a pregnant individual, you would get that through the end of your pregnancy, or if you're caring for, an infant, you could receive services through WIC all the way until they're 5 years old. So it just depends on the condition, as I mentioned here, where you would receive those benefits. But as typically it's usually 6 months to a year at a time. And then you would need to reapply and recertify in order to continue using the program. And then for WIC, this can be used in conjunction with SNAP. So it's not like you have to use one or the other. As long as you qualify, you can receive WIC benefits as well as the Supplemental Nutrition Assistance Program SNAP benefits. And so when and how to access it, again, as long as you're meeting one of those requirements, you're either an individual that's pregnant, breastfeeding, recently had a baby, or you're caring for a child or infant or child up to 5 years old. And again, you can present to your WIC clinic to apply. You could also call the Help Me Grow line for a specific clinic location. So if you're needing assistance in finding one near you, they can help you with that information. There's also an application you can print out online and mail it to your WIC clinic to get the process started. But just knowing that ultimately you are going to have to show up in person to get that appointment going and get approved for that program. All right, pass it back to you, Paula.
All right, the Prevention, Retention, and Contingency Program, known as the PRC program. It is okay, so PRC, Prevention, Retention, and Contingency Program, is it's a very critical tool for Ohio counties that provides benefits, services, and supports to help families overcome immediate barriers to and stay self-supporting. The supports include limited, non-recurring, short-term, crisis-oriented benefits and services that are directly related to the four purposes of the Temporary Assistance for Needy Families program, which is the federal program that funds PRC. So those receiving assistance from other public assistance programs, including SNAP, also may be eligible for PRC services. And so the PRC program falls into three categories: the prevention, which is help paying with utility bills, sometimes car payments or car repairs, maybe the rent for a month. And then retention is help to maintaining employment with job training or a job search, or maybe uniforms for work. And then contingency is meeting an emergent need, which, if not met, threatens the safety, health, or well-being of one or more family members. So families are eligible for PRC, minor child residing with a parent, specified relative, legal guardian, or custodian, pregnant individuals or teens, non-custodial parent who lives in Ohio but doesn't reside with their minor child, and then the family's gross monthly income, earned and unearned, cannot exceed 200% of the federal poverty guideline. But some counties define this depending on the services offered. So Help Me Grow or some types of child welfare services, then the FPG would vary. So the federal regulations doesn't really say 200%, but alludes to 200, so that the guidance is at the state level. So what services does PRC provide? Most of what we see families seek PRC support for is hard services, money paid out to assist with rent, utilities, car note, etc. Again, each service varies by county. For example, transportation services like helping pay for car repairs may be offered in Franklin County, but not in Fairfield. Or the level of what's offered may differ. Franklin may offer car repairs costing up to $300, and Fairfield may offer up to $350. So Franklin may request 3 quotes before they can assist, and Fairfield may require only 2 quotes. The length of time also varies. Some can provide support up to 12 months, some up to 6 months. Other counties require families to say exactly what their plan will be for covering the costs for the following months. So you can access PRC at any time that your family could use work supports and other services to help overcome immediate barriers during a crisis or time of need. And to find out what your county offers to see if you might be eligible and apply, contact your county Department of Job and Family Services, and we provided a link on the slide.
So wrapping it up here, we are going to last talk about another program we support families a lot at OhioKAN with, and give information about the Supplemental Security Income Program for Children, or SSI. And so SSI is a federally funded program that is funded by general tax revenues. So this is not to be confused with SSDI, which is Social Security taxes. So that's where we, every time when we're working, they take out taxes and Social Security gets taken out, and we can pull from that as we age, or if we ended up having a disability and are unable to work. So this is different from SSDI. This is based on financial need and whether an individual has an identified disability. And so as far as eligibility for children for SSI, the child would need to be either blind or disabled, and that disability can begin as early as birth. There's no age requirement to apply for SSI for a child, as long as they have a diagnosis, whether that's medical, developmental, mental health, etc. And so Social Security Administration has different definitions for disability for children versus adults. Kids can get SSI for children until they're 18, but if that disability continues or is expected to continue throughout their life or adulthood, then they will be reevaluated based on the definition of disability for adults. And then there's also a different definition for visual impairment. And we do have those links there if you're curious to take a look at that. And then the other piece of eligibility, as I mentioned, there are some income requirements in order to be eligible. I did want to note here, there's a thing called deeming income. And so basically with deeming income, they look at part of, not all of, but part of the families or the caregiver or parents' income and resources when determining income eligibility. So they make deductions from that deemed income and resources for the parents and for other children living in that home. And then that remaining amount is used to calculate and decide if the child meets that income eligibility part for SSI for children. And then in addition here, just kind of reiterating, the child must have a medical condition or a combination of conditions that results in a marked and severe functional limitation. And that condition must be seriously limiting that child's activities. So again, Social Security has a listing of the various conditions. So in that previous slide, if you wanted to take a look at that definition for children, it should also show some of the examples in there as well. And then the child's condition must have been disabling or be expected to be disabling for at least 12 months or longer, or expected to result in death. So they do evaluate the validity of the medical condition and kind of match that up to what their definition is to see, does this meet eligibility requirements? And then you can provide proof of that, of course, by showing any documentation from a certified professional or a doctor or whoever else to just kind of show proof that, one, that they are diagnosed with this disability and that it's also severe and limiting their daily activities. And then when and how to access it. So again, as soon as the child is diagnosed by a medical professional, you could go ahead and apply. Again, there's no minimum age requirement to apply for SSI for children. I do have here the SSI disability report. So when applying for children, it looks a little bit different. You have to first complete this child disability report. And basically all that is Social Security Administration is going to ask you for detailed information about your child's medical condition and how it affects their ability to perform those daily activities. So they're going to ask about their medical condition by asking you to sign like a release of information that will give them permission to reach out to their providers to look at medical records. They may reach out to therapists or to schools, like if a child is on an IEP. So they try to collect as much information as they can to kind of review so that can help them make that eligibility determination there. And so once they get all of that information, they will contact you. It says 305 business days. That is a typo. It's not going to take 305 business days to get back to you. I meant to put 325 business days. A representative from the Social Security Administration should reach out to you. They'll go over any kind of clarifying questions that they have based on that disability report. And then from there, they will complete and start that application with you. So the first step is completing the disability report. Social Security reaches out to you, kind of goes over everything, and then they'll start that actual application with you. You could set up an account online to start the process, or you could contact your local Social Security Administration office to get the process going. And then the amount of incentive and payment duration for an eligible individual in 2023, it's the maximum payment amount is $914, but this can vary because they look at, like I said, income and resources, and there's other countable income that they take into consideration, so the payments may vary. And then Social Security Administration will send you a letter on approval or denial of that application. The length of time can vary, but average it could take 3 to 5 months depending on the child's disability claim. And then just like I said, with all these programs, just letting Social Security know of any changes to your address or phone number if that occurs. And then after your child gets SSI, they do review your child's medical condition from time to time to verify that that disability still meets criteria. And it just varies on how often they may do that. Any questions on SSI or PRC or the other kind of last couple of programs we covered?
We have a question in the chat.
Okay.
So if you get SSI benefit, would that negate other benefits you receive? And is it considered income for the child that must be reported to other agencies?
Right. So again, if you're getting SSI, it's not going to automatically disqualify you from other benefit programs, right? Because they're wanting to know income, how much the income is for certain programs. So like we mentioned, some programs want to know the income of the household. So if they're looking at income of the household, they're going to know income of the child, so that SSI payment plus any other income. But if they're applying for something, for example, OWF child only, they just want to know the child's income. So you report that SSI being that child's income. So it's not going to necessarily like disqualify you. It's just all depending on like what that monthly gross income amount is for that household or for the child specifically. Did I answer both parts of that question? Make sure.
I think so.
Okay.
Thank you.
Welcome. And then just last here, feel free to connect with us. I know you mentioned Angela. A lot of participants of this support group kind of are already aware of who we are at OhioKAN. But if you're not, we are a free service for kinship and adoption families, helping you to navigate resources and supports based on whatever your needs are for your family, as well as benefits, of course. So feel free to reach out to us. When you do, you'll connect with a navigator who will kind of work with you through the process or through your interaction with us at OhioKAN. And then Paula and I are always available as well, depending on what county you're in Ohio, because half of the county is going through, we're going through an evaluation for the Title IV clearinghouse. And so right now, half of the state is kind of like in the control group, and the other half is the experimental group. And so the control group, unfortunately, we don't connect one-on-one with those families, but we do support our navigators so that they can provide as much information as they can to relate to the families in the control group. Whereas the other half of the state, we're able to actually schedule one-on-one with those families to kind of work through some of these other questions or issues or barriers that you may be running into within your county and accessing benefit programs.
Thank you so much. We actually had one more question come up. Does the child have to live in the home before receiving assistance for resources? Like if someone's becoming a caregiver in the future?
Right. Yeah. I would say yes. Like, for example, if you are wanting to apply for like the Kinship Permanency Incentive Program or the Kinship Caregiver Program, they would need to be in your home. If you're applying for Ohio Works First Child Only, they would need to be residing with you. I mean, pretty much all of the programs, yes, they would need to be living with you before you can actually start receiving access to these programs. However, there are certain times when, a child may already have Medicaid, right? And then they're now living with the caregiver. I mean, it's not like Medicaid is going to stop and then you have to reapply while they're in your household, depending on the circumstance. Because sometimes if you have legal custody, they may say, okay, now we want to take into consideration the income of the household in which the child is residing. Same thing for SNAP. They're looking at the income for the household that, again, lives, buys, and makes food and eats food together.
Well, you're getting a lot of love in the chat, both you, Amber, and Paula. So
You're
just
welcome,
thank you so
everyone.
much. And thanks for being generous with your time as well.